my research is really centred around two areas: healthcare laundry, and that's both domestic washing of uniforms and industrial washing of items like bed sheets and scrubs. And I also do a lot of research in the natural products area, and we're particularly looking at the use of natural products as antimicrobials. But today I'm here to talk to you about domestic laundering of healthcare uniforms and the effects of low temperature laundering on the infection control aspect of the safety of the uniforms. So what I'm going to speak to you about today is what are currently the policies, how these policies, or if these policies are adhered to. We've done a survey across 3 counties and 4 hospitals to have a look at what's actually happening in terms of domestic laundering of healthcare uniforms. And then we've mimicked what we saw from that data in the laboratory and developed methods in order to test what the effect of the low temperature laundering is on the survival of microorganisms. And really we're looking at what evidence there is to support laundering of uniforms domestically and what is really the safe procedure, because ultimately we're at an infection control conference and that's really what we want to look at. Is there any risk, and is the policies and things that are in place at the moment working? So currently, as I'm sure many of you know, the policy for domestic laundering of healthcare uniforms is a wash of 10 minutes at 60 degrees C. And they're washing at lower temperatures, they've said up to 30. You need to use detergent, and it eliminates most other microorganisms. So I think the key word in there is most. The other key things in the policy that I've pulled out that are most probably relevant to what we're talking about today is travelling in the uniform and whether that is covered up, and also visible soiling. The policy currently says that there may be an infection. There isn't an infection risk, but it's disconcerting for people if they see a soiled uniform when nurses are out and about. So, as I said, washing at 30 will remove most gram-positive microorganisms. So we're talking about the Staphylococcuses, the Entococcuses, those types of microorganisms. And a 10-minute wash at 60 will remove almost all of those microorganisms, and only a 1% of Clostridium difficile spores will remain. So that's what the current policy is saying. The evidence for this Department of Health policy is based on 2 literature reviews and some practical work at UCLH. So the first thing that we really wanted to concentrate on is, here's the policy, domestic laundering, what's actually happening? Are these policies being adhered to? What's happening on the ground? So what are the nurses doing? So we did a survey of 4 hospitals, as I said, across 3 counties, and we actually had quite a high respondent rate, which for those of you that have done questionnaires before will realise that sometimes that's the tricky bit, but we had 265 responses, which was considerable across all the surveys that we gave out. And to sort of remove any bias, we broke that survey down into 2 categories. What we wanted to focus on were those working on the infectious disease wards. Were they more aware of the types of risks and the practices that they were doing? And then we looked at non-infectious disease wards. We classed A&E as infectious disease because you don't know what's happening and who could be coming in with what. But things like where it was like physiotherapy, etc., we classed those as non-infectious. So we really wanted to ascertain if there was not only differences in practices because of knowledge, but also if that had an impact. We thought that was important when we were analysing this data. There was lots of questions centred on the physical washing, so what temperature do you want the uniforms washed at, what detergents we used, were they washed with other items. But other questions that we did focus on was their availability for changing of the uniform on site. Was it close to your ward? What may be your reasons for not changing? So it was quite broad in that sense of the type of questions we asked. I am focusing today on the actual laundering part of it. The Department of Health policy says that we should wash at 60 for 10 minutes, however 30 we determined will remove most microorganisms. But what we looked at was the 4 hospitals, what policies were actually being used for nurses. Because nurses sometimes switch from different trusts. And so was that a universal sort of information we were getting across the trust? And as you can see from this slide, it did vary. So when we're looking at laundering temperature here, some hospitals were saying 65 to 71. I'm a stakeholder in the EU revision of washing machines, and they're actually looking at getting rid of some of those high temperature washes. So this would maybe cause a problem. And some say a minimum of 50, which is below the recommended temperature. Detergent type. 3 of the hospitals said no requirement. However, we know that detergent is key in that low temperature washing. I think it's unlikely that someone's going to do their washing without detergent. I mean, on the whole, most of us, especially us mothers, put lots of detergent in, but the policies that were being handed out weren't defining that they had to. Frequency of change, no requirement. That's slightly worrying, I thought. But really, we should be changing after every shift. And wash load of domestic machine, no requirement. So uniforms washed separately. But if you were to follow something like this one, you could be washing it at 50 with no detergent, and with hospital 4 with other items. Which to me is flagging up a little bit of an issue. Okay? It's up to the individual trust to interpret those Department of Health standards. So what do we find then? Here, this was the responses, so 265 responses to the temperatures that we were washing at. Obviously, when you're filling the questionnaire and you know what you should be doing and what you're actually doing, so there may be some skewed data in there, but overall, people were washing at either 60 or 40. So those that were washing at 60, absolutely fine. Those washing at 40 were moving into that category of removing most microorganisms. A few people hand washed, which was a little bit concerning, and some people were going out as low as 30. I should mention here that if a nurse is working on infectious disease ward and your uniform becomes heavily soiled, and recognise that that would be taken off immediately, or should be taken off immediately, and go through industrial laundering. So, items which uniforms are most commonly laundered with. Laundered alone was quite high, but around 40% that were washing their uniforms with other items of clothing. And my thing is, if you've got children, are you washing them with their vests and their socks, etc.? And are this group then washing at 30 or hand washing those items? So it was interesting to see, but again, no statistical difference between the infectious disease wards and those that weren't. So from this, then, we took this evidence. Some of the other things that come up were people were only changing after every other shift, so only washing the uniforms every other shift, and also that nurses were only issued the uniforms on average every 18 months and weren't issued enough uniforms to cover the amount of shifts they were doing. Those are some of the responses that we were getting. What we did from this, we now had the knowledge of what practice we thought was occurring, and we then took it back into the laboratory and started to do the science around it. So my first question is the fibre choice in the uniform correct for the survival of microorganisms? And How long can microorganisms do this? I'm sure some of you are aware. My background used to be an assistant fabric technologist for Aquascutum, so I have quite a strong knowledge of care labels, the mechanical wear of textiles, etc. as well. Some of them, uniforms, have care labels of wash at 50 or 40, when actually we're saying they should be washing at 60. So this is another hurdle that nurses are coming up against. So we started to look at just how the microorganisms surviving on the fibres. We took it back to the fibres, and this really is quite what you'd expect. On cotton, where you get a higher sort of water absorbance, where you've got maybe more nutrients from as a natural fibre, you were seeing that the microorganisms, this is up to 21 days, were able to, there was some decrease, but they were surviving. So we looked at E. coli and Staphylococcus aureus. However, when placed on a polyester fibre, after sort of 150 hours, we were starting to see quite a significant decrease in the E. coli. Staphylococcus was a little bit slower, but by the nature of the two different microorganisms, you'd expect to see that, because Staphylococcus is able to survive on inanimate objects for up to 21 days anyway, roughly. So that's the data just showed what we thought would be happening. However, if any of you in the room are nurses, you're not going to want a fully polyester uniform, not very comfortable. And so what we're really establishing here is that fibre choice and the construction of the uniform itself is also important in infection control. We then took swatches of the standard polycotton textile that you mainly see in nurses' uniforms, and we contaminated those with either E. coli or Staphylococcus. I would say here we chose a very high load, a higher load than maybe you would just pick up on the ward, but what we were doing was challenging policy and seeing how far it would work. So we looked at E. coli and Staphylococcus aureus again, mainly because one's a gram positive, one's a gram negative. And what we did was washed it at 40 degrees Celsius with a biological detergent, because during the survey that was the most used detergent. So we were trying to mimic as closely as we could the practice of what we were seeing from the surveys. And here we have about a 4-log survival of the microorganisms. To put that into context though, because it is on a log scale, we are looking between a 99 and 99.9% reduction, but we are still having 10,000 cells left on the uniform. So it depends how you wish to look at it. But what we also did was put sterile fabric into the wash, because what we were really determining was, if you're washing it with other items, what's the impact on that? Again, I must stress it was very, very high load. And what we found was around 3.5 logs were transferred onto the sterile textiles. So you're looking around 1,000 cells. So the infectious dose of E. coli varies significantly, but if we look at something like E. coli, the gram negatives, standard textbook would say around 100 cells. So we are, you would expect with the detergent in there, because it's got a surfactant, that it would lift the microorganisms, which it is doing, but it appears to be depositing back onto some of the other textiles. Something else I would say about laundering, in food microbiology we use something called hurdle technology, whereas where we do a series of different things that remove, destroy the cells, so you're not targeting it just through one system, so like temperature, etc. When we're looking at laundering, if you were to think of it in those microbiological terms, you have the agitation from the drum moving, you have the dilution factor, you have the detergent, and you have temperature. So really, what we tried to do was establish, and I'll show you some data in a moment, exactly which one of those hurdles was having the most impact on the removal of those microorganisms. I would say here as well, I missed that, we did the polycotton, but we also did 100% polyester because we knew that's where the cells weren't surviving as a sort of a control in there. When we washed at 60, as the policy states, we had all the bacteria was removed and there was no cross-contamination. So that policy is right. It's once we start getting into the lower temperatures and the issues surrounding that, so machines not necessarily having the higher temperatures, the fact that the user is using it at home, etc. What we did then was we took out the effect of the agitation and the dilution factor and just concentrated on temperature and detergent, because it's important to be able to try and pinpoint what exactly is important within this wash. We did it at 71, which is the industrial launderers, 60 and then 40. And we did it for 15 minutes, so just above what the policy states. And we did it with biological, non-biological, halo, which is a low temperature antimicrobial detergent. And then we did it with a standard EEC, so the detergent that you would use when you're doing textile testing. So it's a very good sort of standard strong detergent. And then we looked at reductions. The standard EEC always comes out the best, which you would expect. And we looked at how much we were removing. So this is just the combination of temperature and detergent without that sort of dilution factor. And here where I've circled, if we look at E. coli, we're seeing still quite high numbers, particularly at 40 being left, and we're just looking at that detergent temperature combination. And S. aureus is a bit better, as you'd expect, a bit more susceptible to the detergents. But again, we're still seeing numbers here that are relatively high when you're using it at 40. So by having the combination of detergent and higher temperature, you're having much higher impact on the removal of the microorganisms from the textile. As I said, we wanted to remove the dilution factor and the agitation because that does add to it, but we wanted to know what was happening at a lower, sort of a lesser agitation. So obviously temperature versus detergent, it isn't. It's about the combination and making sure that's correct. So what am I really saying to you today then? From our survey of practice and sort of this in vitro data that we've done, we did test on high loads and it does get rid of most organisms at 40. However, what is left is still there. So is that a risk? We have the above the elbow policy because it was deemed a risk, textiles down to the cuff. So that's a question there. In these investigations I've shown you, we only use type strains, so we only use the standard strains, but we have done some work on clinical isolates that have come out of hospitals, and we're seeing similar results because we're not really looking at the modes of action of the microorganism here, we're looking at removal. So unless their attachment is significantly different, we are seeing very similar results. Something we haven't looked at and would have an impact is drying practices. But this varies so significantly when we were looking at the surveys between seasons. Was it the summer? Is it on the line? Between tumble drying? Between sticking it on the radiator? You know, there was so many different options. We weren't really able to standardise. So what we have done is concentrated on the physical wash. But drying would have some effect on the reduction of the microorganisms. But the difference in practice would make that vary greatly. And as I said, I think textiles, we're aware, are a carrier for microorganisms. And as I've shown here, the high temperature washes work. The lower temperature washes, although they reduce most microorganisms, what is the risk? Has that been established? And I think the key thing is putting in practice, or a practice, or some intervention that will alleviate that potential risk there. So what's a safe laundering procedure, in my opinion, from what we've done and from what we understand. A nurse's uniform should be changed after every shift. Uniforms should be washed immediately. I don't mean the second you walk through the door, but if you're going to leave them in a laundry basket for 48, 72 hours, we know the microorganisms are still there and that they could cross onto other surfaces. So maybe just store them separately or wash them within a 24-hour period of time. They store them separately. The storage, when you get home and throw it on the laundry basket, is just a bigger problem as they're not washing them. So that there needs to be some containment there. Definitely wash clothes separately, other clothes separately. And from the data we've collected, washing at 60 at 10 is the safe option. Whether that is realistic within a normal working pattern, environment, etc., is another question, I think, really. Something that maybe needs to be explored a little bit more. But establishing a risk or the potential risk is also something that needs to be established. So, I'd like to thank our collaborators, the participating hospitals and all the staff that really kindly filled in that survey. And I think the high response rate really showed that people were quite either concerned or passionate about this subject. We've had 3 PhD students working on this. Some are finished, some are still working on it. The Society for Applied Microbiology funded some of the fees of one of the students, and also I'd like to thank Clinical Fabric Solutions for sponsoring me to come and tell you all about the research that we have been doing.